Hi Jamie, my name is Tara and I will be doing your peer review for your gastrointestinal assessment video. Overall, I thought you did a really great job. I thought you were able to hit all the key points and discuss the proper way to inspect, auscultate, palpate, and percuss. And I actually had to remind myself that that was the order just for abdominal. I think you did a great job, even though you didn't have a person to do it on. I think you did a great job of using what you had and properly showing techniques, as well as discussing how you would do it in the sense that people would be able to repeat what you were showing. I know you went over appendicitis. I know in the first job I had in one of the ICUs, we had a lot of detoxing patients from alcohol, and a lot of right upper quadrant pain was seen. So we did a lot of abdominal assessments in that way, with a lot of tenderness in that right upper quadrant. So we did a lot of inspecting, and sometimes their abdomen would be quite distended, slightly firm, all related to liver issues. And then sometimes their kidneys would play a role as well if their kidneys were shutting down. I also saw that in that job, along with the jaundice. But back to the abdominal, we would, like you said, inspect. Obviously their abdomen would be rounded, slightly distended, sometimes slightly firm. Bowel sounds, it depended on activity and whatnot. A lot of times their liver, the percussion part of it would not be very tympanic. It would be quite dull. And then the palpation, even upon light palpation, some people had very tender areas up in their right upper quadrant related to that liver disease. It depended a lot on how far along. I've seen quite young individuals come in with liver failure, and it's quite sad. At my recent job, I deal with a lot with cardiac patients and assessing. They go into their kidney issues, so palpating the kidneys and percussing the kidneys has been a new experience for me, as well as looking at their abdomen, because after major heart surgeries, it's quite interesting to see how, and like any surgery, how the medication slows down your bowels. So just trying to stay on top of our abdominal inspection is also as important as every other body system. And I think sometimes people forget how important that is, because you don't want it to result in a small bowel obstruction, or ileus or whatnot. And in my line of work, we've been seeing, I've seen, I should say, a lot of ileuses in relation to like after post-op. And just trying to treat that and make sure that the bowels are moving, and the motility and active bowel sounds has been a huge factor. And it's been a very large learning experience for myself, just seeing how post-op patients, with all the medications and whatnot and intubation, can slow down the GI tract. So that to me is another example. But overall, again, like I said, I think you did a really good job of showing the assessment, and how you would go about that. I like how you labeled the quadrants as well, just to kind of as a point of reference on your patient. But overall, great job.